Hello, it's Dr. Rod Story. I want to address some questions I'm receiving from people regarding the coronavirus, particularly related to how they can prevent transmission to others and how they can be kind neighbors within their community when the coronavirus comes, which it's coming in the next couple of weeks. There's actually quite a few different recommendations that you might be seeing, whether on Facebook or elsewhere, and I think actually they mix it up in some ways that isn't always helpful. So let's define the terms and individualize those recommendations. The first recommendation is something called social distancing. It's the idea of how do you keep one individual in a large group from spreading it to everyone and then having a large outbreak. And it's the idea that if we voluntarily reduce our contacts with larger groups, that really helps. Whether that's doing work from home, whether that's doing school online, whether that's canceling sporting events, or whether that means things like church where we take steps to reduce the amount of time or contact that we have with people. I think there is a variety of ways of approaching that. Regardless of them, they all have actually good precedent. We did something similar with previous epidemics, including 1918, where we have data that shows that those communities that took that step really dramatically reduced the overall rise of those illnesses and the number of individuals that ultimately became sick with it. However, not without a caveat, and that is that it made those communities experience the illness longer in their community, not just weeks, but months. And it often had a second wave of illness, which both of those things really need to be talked about and help thoughtfully prepared for. That's an appropriate posture for us. It's hard to know exactly when to recommend that as a community, but obviously many are taking that step. There's a second step that is right for some individuals, but I think is actually overly aggressive to be applied to everyone. And that's the idea of isolation or taking to your home. For some individuals, those that are at high risk, whether they're over the age of 70 or particularly over the age of 80, whether they have significant health conditions like heart failure or heart conditions, lung conditions like COPD or emphysema, or they're on immune suppressant agents for cancer or arthritis conditions, those individuals we know are much, much higher risk of not doing well with coronavirus. Those individuals really need to take an additional step and start planning for taking to their home. What that means is planning for who's going to bring you groceries and how are you going to limit the number of people that you contact with, whether that's your immediate family or otherwise. And particularly, it might take the role of saying, I'm not going to be seeing people who might carry it like grandkids for several weeks, if not longer. That's definitely a much bigger step. Really appropriate for some individuals at higher risk, and those individuals should be encouraged to do that, but not really appropriate for everyone and not necessary. So I'd encourage you, be well informed, know what your risks are, talk to your physician, make sure you begin planning and also taking the appropriate steps, whether that's just generally being wise for how you can protect and care for your family and care for your neighbor, but even more specifically, how you can be personally accountable for caring for yourself. Thanks for your time.